يومكم طيب. I'm quite happy to meet you again through this recording. I am Dr. Kamas, Professor Emeritus of Transplant Surgery at the Ohio State University. Today, still within the corner of the one of the corners of the channel. Today's the topic is medical ethics. We're going to continue through the medical ethics manual of the WMA. As we know, this course, hopefully by the time you complete the discussion with the book as the reference, we will have a nice course in basic medical ethics. The course is not going to allow you to become an ethicist, but it will give you a very nice introduction and familiarity with all the components and the terminology of the medical ethics, where you can read further based on your interests. So when you read an article in a professional ethics journal, you will be able to understand it and add to your armamentarium and your knowledge database. Our main reference is the Medical Ethics Manual. The topic today is dual loyalty, and at the end of the lecture we will get into the resource allocation. Of course, the book is available in the link written down below, and in blue that link leads you to the PDF version of the book on the website of the World Medical Association. And maybe the best thing is to start with the question, what is dual loyalty? هل أنت familiar with this term before or not? لأن طبعا if you are not familiar with it, it would be a good idea so we can go over the definition. Loyalty طبعا in Arabic تعني الولاء. الدول اللي هي باللاتيني يعني اثنين، يبقى معناها الولاء المزدوج. ممكن هذه ترجمتها. الولاء المزدوج يعني أحيانا كثيرة بصراحة يسبب في إحراج للدكتور. و these days الولاء المزدوج موجود بكثرة. يعني in the old days your loyalty is really clearly to your patient. There is no competition. But as civilization progressed, now we have institutions, we have hospitals, we have Ministry of Health, we have societies, we have colleagues. And when you read in the Code of Ethics, you read that too. You read that, for example, in the International Code of Ethics or any other local Libyan, Egyptian, Tunisian Code of Ethics, any one, you will find that there is section, the main section, your loyalty and the things that are related to the patient, and then there is section your relation to the colleagues, and a third section relation to society. So these days it's not really unusual to find yourself in a situation where you have to choose from. I'll give you an example before I go any further. يعني أنت your loyalty is to the confidentiality of the patient أو سرية المريض. يعني نعرف أن هذا الشيء أمر مقدس في الميديكال ethics. معلش اختلاف، معلش وجهات نظر عديدة، ولكن there are certain situations where you can breach أو break the confidentiality. يعني ما تحافظش على سرية المريض. هذه هنا تحدث لك مثلا مع المجتمع إذا كان المريض عنده infectious disease، عنده HIV، يبقى your loyalty to the patient أنك أنت تحافظ على سره. فعلا that's true. You have to keep the confidentiality of the patient. You don't talk about it to other people. You don't talk about it to your colleagues, your family, friends and so on. ولكن his or her partner يعني إذا كان هو متزوج يبقى زوجته لها الحق إنها تعرف، وإذا كان هي متزوجة يبقى زوجها لها الحق إنه يعرف. فهنا dual loyalty مهمة جدا، وتقول أن في الحالة هذه we have to skip the confidential loyalty to the patient. We have to mention it to the other individual one way or the other. يعني في certain ways and how to be able to reach to a situation by law. يعني بالقانون لازم تبلغ. كويس، واحد عنده كوفيد من المنطقة انك انت بتبلغ عليه في قانون بيقول انك انت تبلغ مديرية الصحة او CDC او المركز مكافحة الامراض او لجنة التقصي اللي موضوع المرض والمكافحة او حاجة بمكانك. يعني بالقانون يبقى في الحالة هذه اللويالتي بتاع المريض انك انت ما تحكي عليه للآخرين، ولكن للمجتمع ضروري بتبلغ، هذا بالقانون. فهذا that's what really dual loyalty means. يعني أنك أنت في بعض الأحيان بتفاضل ما بين السوسايتي وما بين loyalty to the patient. في الهوسبيتال the same thing, your loyalty to the hospital يعني في الحالة هذه should not really be ahead of your loyalty to the patient. For example, if the hospital has to deal with different companies, because the hospital is a business. And you want to serve your patient with the best evidence-based medicine, whether it's material that you use in the surgery or equipment used for diagnosis or tests you order or anything. Pharmaceutical companies, that is another thing. I think we will talk about it a little bit in a different slide. يعني هم بيغدوك وبيعشوك وبيرفعوك لكونفرنس وبيدفعوا عليك الهوتيل، يدفعوا عليك الريجستريشن فيز. هذا بالأكيد يعني هم غرضهم مش ببلاش، يعني مش على سواد عيونك. So you need to be careful. They do all this. They want something in return. You could buy equipment from them, or you could buy their drugs, or you could use their drugs if somebody else was involved in the buying. It's very important, this situation of dual loyalty. You could see it affect the patient's outcome. And if you start using antibiotic, that's really not that effective, but it's based on a company you are very familiar, you know their representative, تعرف الوكيل, he always send you to conference, you and your wife. It's not really ethical بصراحة. Insurance, police, crime, and so on. So all these sometimes situations become quite difficult, and where you will face the dual loyalty, and you have to have the ethical background so you can differentiate. Pharmaceutical companies that create, and I want to focus on it a little bit because it does create a conflict of interest. From my experience in Libya, there are many doctors who own pharmaceutical companies. they يستوردوا في أدوية ويستوردوا في معدات طبية. if you as a doctor you are practicing and you use المعدات الطبية اللي أنت بس تستوردها شركتك, maybe you get into conflict of interest and some unethical behavior. And I think if you are using, if you have a medication, for example, you are importing a medication with a brand name, we randomly will use, for example, insulin or Rosifin or anything, and you start pushing your colleagues and pushing the Ministry of Health to use in their guidelines, use that brand name insulin only, because until wakil imtah. And you know that there are a lot of generic companies that produce generic insulin that is really good and effective. It become very clear that's unethical behavior. But if there is evidence-based medicine that whatever medicine you are importing is really superior to any other generic medication, that's a different story. So you could see the situation sometimes in the developing countries. Insurance and government policies, yeah, you cannot affect them because you cannot affect them simply, but you, through your association, you should really campaign to the officials and to the insurance if you see something that's not serving your patients. You as a group, you have a medical association. That's why the medical association is different from al-Naqaba. You really need a medical association that protects you and your patients both. So it helps the citizen. Its loyalty is not to pharmaceutical companies, its loyalty is not to the government, its loyalty really to the individual patients and the doctors. الريسورس allocation يعني ممكن بندخل شوية slides بسيطة. If you see any country, whether rich or poor, there's always a gap أو في مساحة أو مسافة ما بين المطلوب للخدمات المثالية وما بين المتوفر. يعني most of my viewers من ليبيا، لما تجي لليبيا واضح أن الحاجة غير جيدة، المنظومة الصحية غير طيبة. The Libyan citizens are being treated abroad, so there is a need somewhere. So, and if you come to the United States, the same thing. There is a gap. So always that need. So what does that mean? It means that whatever services you have, you need to ration it. يعني إذا كانك أنت ما عندكش بنزين you ration it. وبتاعت السيارات الإسعاف الأولوية إنها تاخذ بنزين. For example. Same thing with the healthcare situation. Medication, equipment, region, certain diseases, and so on. So resource allocation is very, very important topic on the ethical or medical ethics. And it has three levels. The macro level على مستوى الدولة. مستوى الوزارة بتقرر how much money they want to spend on doctors' salaries, how much money they spend on medication, how much money they spend on equipment, how much money they spend on hospitals, and so on. The meso level is the level of the hospitals and the institution, how much the hospitals spend money on equipment, and the same questions again. Now, our interest or my interest is the micro level. What is the micro level? Micro level اللي هو individual level, يعني physician level. أنت دائما as a physician you have to keep in mind إنه أمامك core of the medical ethics اللي هي compassion, competence, and what else? Compassion, competence, and autonomy. So three هذوما they should be really in front of you all the time. ولكن في situation يعني you need to be careful with it. So the brand name medication, we mentioned that we talked about it. So if you are getting fed and sent to conferences by a company or your company importing a brand name medication and there is no evidence that is it is superior on generic medication, you keep pushing for it, that's unethical behavior. If you order tests because it's more income for the masaha, that's unethical behavior. But if the test is needed for the diagnosis, that's okay, absolutely okay. If you refer the patient to a certain صيدلية to get the medication from because you are dealing with that pharmacist, unethical behavior. If you admit the patient للمصحة ومحتاج الدخول, unethical behavior. أو أنا كنت أدخله من الفلور إلى العناية المركزة لأن المركزة فاضية ما فيهاش سر يعني ما فيهاش مش محجوزة وبالتالي أنت you want more income لأن because of the ICU is and the critical care is more expensive. That's very unethical behavior. So these So you'll find that ethics really follows you in every move you do as a doctor, and 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 everywhere you do, you have to keep in mind compassion, competence, and autonomy. We're going to add justice اللي هو العدل. ويدخل طبعا في الريسورس allocation العدل. موضوع يعني مثلا for example the vaccine that's going to be currently being used. How about the people who are in need but in remote areas? Are you going to take specific consideration and send it to them or not? Is that justice, or should we give all the amount of medication we have to the healthcare workers? So these kind of things you have to ask yourself as a physician or as an official who is responsible for distributing that vaccine. Maybe in the next week we'll continue more and elaborate more on resource allocation, and we'll mention also some of moral theories. And in the meantime, have a really great week, and I wish you the best. If you like the content and if you have time, you log in and you subscribe, would be really greatly appreciated. If you leave a comment, I love that. I love to hear and read the comments because they give me a clue whether I'm doing well or I need to decrease the length or increase the length or change the content or whatever. If you don't, I understood, and that's fine. No problem, no hard feelings. Have a wonderful week, and we'll see you next week. Thank you.